What is the most effective method for maintaining sterility when performing a catheter insertion in a patient who has been diagnosed with a urinary tract infection (UT)? Explain the critical steps involved in applying advanced aseptic techniques in this scenario, including the role of the nurse in preventing cross-contamination. Answer: maintaining sterility during catheter insertion is crucial to prevent additional infections, especially in a patient with an existing UTI. The nurse should follow these advanced aseptic techniques. Prepare the environment. Ensure the environment is clean and free of contaminants. If the procedure is being performed outside a sterile environment, e.g., patient's room, the nurse should use sterile drapes to create a sterile field. Hand hygiene. Perform hand hygiene using alcohol-based hand rub before and after the procedure to reduce the risk of contamination. Sterile equipment. Ensure all equipment, including the catheter and sterile gloves, is sterile. This is crucial to avoid any introduction of pathogens. Proper technique. Apply sterile gloves. Use a sterile drape to cover the patient's genital area and clean the urethral meatus with an antiseptic solution. Maintain sterility of the equipment by not touching non-sterile surfaces. Catheter insertion. Insert the catheter using the sterile technique. Avoid any unnecessary contact with the catheter or the urethral opening once the procedure begins. A nurse is administering a dose of IV morphine to a patient experiencing severe pain. The prescribed dose is 2 mg every 4 hours as needed. The nurse notices the patient is becoming increasingly drowsy and confused after the second dose. What should the nurse assess to determine whether the patient is experiencing an adverse reaction to the medication? Answer: the nurse should assess the following key indicators to determine whether the patient is experiencing an adverse reaction to morphine. Respiratory rate. Morphine can cause respiratory depression, which is a life-threatening side effect. The nurse should assess the patient's respiratory rate, depth, and effort to ensure adequate ventilation. CNS symptoms. Drowsiness and confusion can indicate central nervous system (CNS) depression, a known side effect of opioids like morphine. The nurse should assess the patient's level of consciousness, orientation, and overall cognitive function. Pain level. The nurse should reassess the patient's pain level to determine if the morphine is providing adequate analgesia, which can help guide the nurse in determining if the confusion is related to the drug or the pain itself. Vital signs. Monitoring blood pressure and heart rate is essential, as opioids can also cause hypotension and bradycardia. Medication interactions. The nurse should review the patient's medication history for any drugs that could interact with morphine, such as benzodiazepines, which can enhance CNS depression. Mr. Smith, a patient with an infectious disease requiring airborne precautions, is scheduled for a diagnostic imaging procedure outside his isolation room. What steps should the nurse take to ensure the patient's safety and prevent the spread of infection during transport? Answer: the nurse should take the following steps. Ensure proper PPE. The nurse should ensure that both the patient and transport staff wear appropriate personal protective equipment (PPE). This includes an N respirator for staff and a surgical mask for the patient to reduce the risk of airborne transmission. Prepare the patient and environment. Ensure that the patient is placed in a clean, dedicated transport chair or bed. Use a clean sheet or covering to prevent direct contact with any potentially contaminated surfaces. Minimize time outside the isolation room. Limit the time the patient spends outside the isolation room to reduce the exposure risk. Contact the imaging department. Inform the imaging department about the patient's infection status so they can prepare the area and follow protocols to handle infectious patients. Post-procedure cleaning. After the procedure, the transport equipment and patient's room should be thoroughly cleaned, and the staff should perform hand hygiene to minimize the risk of cross-contamination. A nurse administers a beta blocker to a patient with hypertension. The nurse is aware that beta blockers can mask the symptoms of hypoglycemia in diabetic patients. How should the nurse monitor for hypoglycemia in a patient taking both a beta blocker and insulin therapy? Answer: in patients who are on both beta blockers and insulin therapy, the nurse should monitor for hypoglycemia by monitoring blood glucose levels. The nurse should regularly monitor the patient's blood glucose levels, particularly during times when insulin is administered. This is crucial as beta blockers can block the typical symptoms of hypoglycemia, such as tachycardia and tremors. Assessing mental status. Symptoms of hypoglycemia in these patients may be more subtle and can manifest as confusion, dizziness, or lethargy. The nurse should assess the patient's mental status regularly, checking for sweating. Sweating may still be a symptom of hypoglycemia in patients taking beta blockers, so the nurse should monitor the patient for excessive sweating, especially in the absence of fever. Patient education. Educate the patient on the potential for masked symptoms and the importance of frequent blood glucose monitoring. A nurse is setting up an isolation room for a patient with suspected tuberculosis. What are the critical components of the isolation protocol that the nurse must follow to prevent the transmission of the infection? Answer: the nurse should follow the airborne isolation precautions protocol, which includes the following key components. Room requirements. The patient must be placed in a single room with negative pressure ventilation to prevent the airborne pathogen from spreading to other areas of the facility. Personal protective equipment (PPE). The nurse and other healthcare workers should wear a properly fitted air and respirator mask when entering the room. Visitors should also be instructed to wear appropriate PPE. Limited patient movement. Limit the patient's movement outside the isolation room to essential activities only. If transport is necessary, the patient should wear a surgical mask. Proper hand hygiene. Hand hygiene must be performed before and after entering the isolation room and after any contact with the patient or the environment. Disinfection and waste management. All surfaces in the isolation room should be disinfected regularly, and any materials contaminated with respiratory secretions should be disposed of in accordance with infection control guidelines. How can a nurse minimize the risk of ventilator-associated pneumonia (VAP) in a critically ill patient receiving mechanical ventilation? Answer: the nurse can minimize the risk of VAP by implementing the following practices. Elevating the head of the bed. Maintain the patient's head of the bed at an angle of 3.045 degrees to reduce the risk of aspiration, which is a common cause of VAP. Oral care. Perform regular oral hygiene with antiseptic solutions to reduce the colonization of harmful pathogens in the mouth and upper airway. Sedation management. Minimize sedation and use spontaneous breathing trials to reduce the duration of mechanical ventilation. This reduces the risk of VAP by allowing for earlier extubation. Ventilator care. Ensure that ventilator tubing and circuits are kept sterile and changed according to hospital protocols. Early mobilization. If possible, encourage early mobilization and weaning from the ventilator to prevent prolonged exposure to mechanical ventilation. By following these steps, the nurse can significantly reduce the incidence of VAP, improving patient outcomes. Ms. Garcia, a patient with a recent abdominal surgery, requires a wound dressing change. The nurse is concerned about maintaining sterility during the procedure. What are the key steps the nurse should take to ensure the dressing change is performed using an advanced aseptic technique? Answer: the nurse should follow these critical steps for maintaining sterility. Prepare the environment. Ensure the environment is as sterile as possible by cleaning the surface with an antiseptic wipe before setting up the sterile field. Hand hygiene. Perform hand hygiene before and after the procedure to prevent introducing pathogens into the sterile field. Sterile gloves and equipment. The nurse should wear sterile gloves and use sterile instruments for dressing change. The dressing materials, saline and gauze, should all be sterile. Clean the wound area. Clean the wound site using a sterile saline solution and a sterile gauze pad to remove any debris. Avoid touching any non-sterile surfaces. Dressing application. Apply the sterile dressing without touching the exposed area or non-sterile parts of the dressing. By following these steps, the nurse ensures that the wound is properly dressed without compromising sterility, preventing potential infections. A nurse is preparing to administer a drug classified as a non-steroidal anti-inflammatory drug (NSAID) to a patient with chronic arthritis. What should the nurse know about the common contraindications and potential risks of NSAID therapy in this patient? Answer: the nurse should consider the following contraindications and risks associated with NSAIDs in patients with chronic arthritis. Gastrointestinal bleeding. NSAIDs can increase the risk of gastrointestinal ulcers and bleeding. The nurse should assess the patient for any history of GI problems, such as ulcers or bleeding disorders. Renal impairment. NSAIDs can lead to renal toxicity, especially in patients with pre-existing kidney disease. The nurse should monitor renal function regularly, including blood urea nitrogen, BUN, and creatinine levels. Cardiovascular risk. Long-term use of NSAIDs can increase the risk of cardiovascular events, including heart attack and stroke. The nurse should assess the patient's cardiovascular history before starting NSAID therapy. Use of concurrent medications. NSAIDs should be used cautiously with anticoagulants, corticosteroids, or other medications that affect coagulation, as they may increase the risk of bleeding. A nurse is responsible for ensuring compliance with infection control protocols during a surgical procedure. What are the primary steps involved in maintaining a sterile environment during the operation? Answer: the nurse should follow these steps to maintain a sterile environment during surgery. Prepare the operating room. Ensure the operating room is clean and disinfected. All sterile supplies should be arranged on a sterile field and any non-sterile items should be kept away from the field. Sterile gowning and gloving. All surgical team members must don sterile gowns and gloves before entering the sterile field to prevent contamination. Monitor sterility throughout the procedure. The nurse should vigilantly monitor the sterile field and ensure that it is maintained throughout the surgery. Any breach of sterility should be promptly addressed by replacing contaminated items. Sterile drapes and instruments. Ensure that sterile drapes are applied to the patient and only sterile instruments are used for the procedure. Maintain aseptic technique. The nurse should ensure that sterile instruments, supplies, and hands are used throughout the surgery to prevent any infections. A patient has been admitted with dehydration due to vomiting and diarrhea. The nurse is concerned about restoring the patient's fluid and electrolyte balance. What should the nurse consider when administering intravenous fluids for rehydration? Answer: when administering intravenous fluids for rehydration, the nurse should consider the following key factors. Assess the severity of dehydration. Evaluate the patient's dehydration status by checking vital signs, skin turgor, urine output, and mucous membranes. This helps determine the type and rate of fluids needed. Select the appropriate fluid. Choose the correct type of IV fluid based on the patient's electrolyte imbalances and overall condition. Electrolyte replacement. Ensure that the chosen IV fluid contains adequate electrolytes like sodium, potassium, and chloride. In cases of severe diarrhea, the patient may require potassium supplementation to correct hypokalemia. Fluid volume and rate of administration. Start with an initial bolus of fluid, usually 500 ml over 1 hour for adults, depending on the severity of dehydration. Afterward, continue with maintenance fluids, adjusting for the patient's ongoing losses. Monitor for complications. Monitor the patient for signs of fluid overload, especially in patients with underlying conditions like heart failure or renal impairment. What is the primary purpose of the nursing process and how can it be applied to develop patient-centered care? Answer: the nursing process serves as a systematic, patient-centered approach to provide individualized care. It is composed of 5 stages: assessment, diagnosis, planning, implementation, and evaluation. Each stage helps nurses assess patient needs, make appropriate diagnoses, plan interventions, implement care, and evaluate the outcomes to ensure the best possible patient outcomes. Assessment: collecting data through physical examinations, health histories, and diagnostic tests. Diagnosis: analyzing data to identify nursing diagnoses that may or may not align with medical diagnoses. Planning: creating a care plan with patient-specific goals that are measurable and time-bound. Implementation: delivering care that aligns with the plan, ensuring therapeutic communication and patient involvement. Evaluation: determining if the care goals were achieved and adjusting the care plan as necessary. When conducting an assessment of vital signs, what are the critical considerations in evaluating pulse irregularities and how can they be linked to specific health conditions? Answer: pulse irregularities can indicate several cardiovascular or systemic issues. When assessing a patient's pulse, it is important to measure rate. Count the beats per minute. A normal pulse rate for adults is between 60 and 100 beats per minute. Assess rhythm. Determine whether the beats are regular or irregular. Irregularities may indicate arrhythmias such as atrial fibrillation or ventricular tachycardia. Evaluate strength. Check if the pulse is bounding, weak, or thready, which may suggest conditions such as dehydration, heart failure, or blood loss. Assess for equality. Compare pulses bilaterally to check for asymmetry, which may indicate a blockage or arterial obstruction. For example, if a patient has an irregularly irregular pulse with a rate of 120 bpm, it could indicate atrial fibrillation, a condition where the atria beat erratically and rapidly. In contrast, a thready pulse with a rapid heart rate could suggest shock or significant blood loss. Mrs. Martinez is a 78-year-old woman who is undergoing treatment for pneumonia. Her vital signs include a blood pressure of 90, 60 mmHg, a heart rate of 110 beats per minute, and a temperature of 102 degrees. Upon auscultation, crackles are noted in both lung fields. What should the nurse prioritize in this scenario and why? Answer: given Mrs. Martinez's clinical presentation, the nurse should prioritize her airway and respiratory status, followed by addressing hypotension and tachycardia. Respiratory status: the presence of crackles in both lung fields suggests fluid in the lungs, likely due to pneumonia. The nurse should monitor for signs of respiratory distress such as increased work of breathing, dyspnea, or hypoxia. Supplemental oxygen may be necessary to improve oxygen saturation. Hypotension and tachycardia: The low blood pressure 98 G and elevated heart rate 110 bpm suggests that Mrs. Martinez may be in early septic shock, as both symptoms can be signs of sepsis. The nurse should ensure fluid resuscitation and notify the healthcare provider for further management. Temperature management. Fever 100 is common in pneumonia, but the nurse should continue to monitor and provide antipyretics as needed to maintain comfort. How can a nurse ensure accuracy and legal compliance when documenting patient care, particularly when a patient refuses treatment? Answer: accurate documentation is critical in nursing practice to ensure legal protection, continuity of care, and regulatory compliance. When documenting a patient's refusal of treatment, nurses should use clear, objective language, avoid subjective statements like "the patient didn't want the medication." Instead, document that the patient verbally declined the prescribed medication after being informed of the benefits and risks. Record the patient's understanding. Document that the patient was fully informed of the treatment options and potential consequences of refusal. This is important for ensuring the patient's autonomy and decision-making capacity. Include the date and time. Ensure that all entries are time-stamped accurately, reflecting when the refusal occurred. Involve the healthcare provider. If a refusal involves significant risks or affects the plan of care, notify the healthcare provider and document their response. Documentation of refusals should always be done in a non-judgmental, factual manner to protect both the patient's rights and the nurse's professional responsibilities. What is the significance of standard precautions in infection control, and how does this differ from transmission-based precautions? Answer: standard precautions are a set of infection control practices that assume all blood, body fluids, non-intact skin, and mucous membranes may contain infectious agents. These precautions include practices such as hand hygiene, personal protective equipment, PPE, like gloves and masks, and the proper disposal of contaminated materials. Transmission-based precautions, on the other hand, are used when a patient is known or suspected to have a specific infectious disease that requires more stringent measures than standard precautions. There are three types. Contact precautions, used for infections spread by direct or indirect contact, e.g. MRSA. C. Difficile, requires gloves and gowns. Droplet precautions, used for infections transmitted by large respiratory droplets, e.g. influenza, requires a mask when within 3 feet of the patient. Airborne precautions, used for infections spread through tiny airborne particles, e.g. tuberculosis, requires an end respirator and negative pressure rooms. When assessing a patient's pain, what are some key tools and approaches a nurse can use to ensure effective pain management, particularly in nonverbal or pediatric patients? Answer: when assessing pain in nonverbal or pediatric patients, it is essential to use age-appropriate tools and methods, as these patients may have difficulty expressing their pain verbally. FLACC scale, face, legs, activity, cry, consolability. This scale is used to assess pain in infants and young children by observing behavioral cues such as facial expressions, body movements, and crying. Wong-Baker FACES pain rating scale, often used for children as young as 3 years old. This scale uses faces with varying expressions to help children describe their pain levels. Behavioral observations. In nonverbal adults, observing for signs of agitation, restlessness, or changes in vital signs, e.g. increased heart rate or blood pressure, can be key indicators of pain. For nonverbal patients, it is also important to gather input from family members or caregivers who are familiar with the patient's normal behavior. Mr. Thompson, a 65-year-old male with a history of hypertension and diabetes, is being treated for a leg wound that is not healing well. His blood glucose levels are consistently high, and his blood pressure readings fluctuate. What nursing interventions should be implemented to support his wound healing and manage his comorbidities? Answer: the nurse should implement the following interventions. Blood glucose control. High blood glucose levels can impair wound healing and increase the risk of infection. The nurse should collaborate with the healthcare provider to adjust insulin or oral hypoglycemic medications and educate Mr. Thompson on the importance of glycemic control. Blood pressure management. Fluctuating blood pressure can impact circulation to the wound, hindering healing. The nurse should monitor blood pressure regularly and ensure Mr. Thompson is adhering to antihypertensive medications and lifestyle changes, e.g. low-sodium diet. Stress management. Wound care. Proper wound care, including regular cleaning, debridement, and dressing changes, is essential. The nurse should also assess for signs of infection, redness, warmth, swelling, and ensure that Mr. Thompson is following recommended hygiene practices. Nutritional support. Ensure Mr. Thompson is receiving adequate nutrition, including protein and vitamins, especially vitamin C and zinc, which are vital for wound healing. What are some critical nursing considerations when providing patient-centered care to individuals from diverse cultural backgrounds? Answer: providing culturally competent care involves understanding and respecting the unique cultural beliefs and practices of each patient. Critical nursing considerations include therapeutic communication, adjusting communication styles to be culturally appropriate, such as using an interpreter when necessary, avoiding jargon, and demonstrating empathy. Cultural sensitivity, understanding specific cultural practices related to health, illness, and healthcare decision-making. For example, certain cultures may prefer family-centered care or may have alternative medicine practices. Respect for autonomy, recognizing the patient's right to make informed decisions about their care while considering cultural values that may influence those decisions. End-of-life care. Some cultures have distinct beliefs about death, the afterlife, and rituals related to dying. The nurse should assess these beliefs and ensure that care plans respect these practices. What role does documentation play in nursing practice, particularly in legal contexts, and how should nurses ensure the accuracy and completeness of their records? Answer: documentation is essential in nursing practice for ensuring the continuity of care, providing evidence of the care provided, and protecting the nurse legally. To ensure accuracy and completeness, nurses should be factual and objective, document what was observed and performed, avoiding personal opinions or assumptions, follow legal requirements, ensure that all documentation is legible, timely, and signed with the date and time accurately recorded. Use appropriate formats. Common documentation formats include SOAP, PIE, and DAR, which allow for systematic recording of patient data and care plans. Avoid errors and omissions. Double-check entries for accuracy and completeness, particularly when noting changes in the patient's condition or any adverse reactions to treatments. How does the nurse ensure the correct use of transmission-based precautions when caring for a patient with a known airborne illness? Answer: when caring for a patient with an airborne illness, e.g. tuberculosis, measles, the nurse must adhere to airborne precautions to prevent the spread of infection. Personal protective equipment, PPE. The nurse must wear an respirator mask to filter out airborne particles. Standard surgical masks are not effective for airborne pathogens. Isolation room. The patient should be placed in a negative pressure room that prevents air from escaping into other parts of the healthcare facility. Patient transport. If the patient must be moved, they should wear a surgical mask and the transport should be minimized. Hand hygiene. The nurse should perform thorough hand hygiene before and after interacting with the patient, as well as after removing PPE. These precautions ensure that the spread of airborne diseases is minimized, protecting both healthcare workers and other patients. A 45-year-old female patient presents with severe abdominal pain, nausea, and vomiting. On examination, she is found to have tenderness in the lower right quadrant with a positive rebound tenderness test. How should the nurse proceed with the assessment of what are the likely causes of these symptoms? Answer: in this case, the nurse should follow the proper abdominal assessment sequence: inspection, auscultation, percussion, and palpation. The nurse should inspect for any visible abnormalities, auscultate for bowel sounds, e.g. hypoactive or hyperactive, percuss for tympany or dullness, and palpate gently, avoiding direct palpation of the painful area. Rebound tenderness, which suggests peritoneal irritation along with localized pain in the lower right quadrant, is suggestive of appendicitis. Appendicitis is a common cause of acute abdomen, but other differential diagnoses include ovarian cyst rupture or ectopic pregnancy. The nurse should initiate appropriate interventions, e.g. pain management, NPO status, and notify the healthcare provider immediately for further investigation and possible surgery. Key guidelines laws. Clinical practice guidelines. The American College of Surgeons emphasizes that early identification and timely intervention in appendicitis can prevent complications such as perforation. Nursing standard of care. Nurses must assess and document abdominal symptoms thoroughly, using critical thinking to identify potentially life-threatening conditions. Which nursing interventions are most effective in preventing urinary tract infections, UTIs, in patients with indwelling urinary catheters, and why are these interventions critical in maintaining patient health? Answer: the most effective nursing interventions to prevent UT is in patients with indwelling catheters include proper aseptic technique during catheter insertion to minimize the introduction of pathogens, maintaining a closed urinary drainage system by ensuring the catheter is not disconnected from the drainage bag, encouraging hydration to promote regular voiding and flushing of the urinary tract, regular perineal care with mild soap and water to reduce the risk of contamination, avoiding prolonged catheter use and considering alternatives when possible to decrease infection risk. These interventions are critical because patients with indwelling catheters have A significantly higher risk of developing UT is due to bacteria ascending the catheter and entering the urinary tract. UTIs can lead to serious complications such as sepsis or kidney damage, particularly in immunocompromised or elderly patients. Mr. Thompson, a 60-year-old male with a history of chronic constipation, reports new onset of severe abdominal distension, nausea, and absence of bowel movements for 48 hours. He has a low-fiber diet and limited fluid intake. What steps should the nurse take to assess and manage his condition considering these symptoms? Answer: the nurse should take the following steps. Initial assessment. Perform a thorough abdominal assessment, including inspection for distension, auscultation for bowel sounds, noting any hypoactive or absent sounds, and gentle palpation to assess for tenderness and peritoneal signs, obstruction or impaction. Based on the symptoms, there may be a bowel obstruction or fecal impaction. The nurse should notify the healthcare provider immediately for further evaluation, which may include imaging studies, e.g., X-ray or CT scan, to assess for obstruction. Bowel care protocols. The nurse should initiate measures to relieve constipation, such as administering stool softeners, encouraging hydration, and providing a high-fiber diet if not contraindicated. Monitoring and education. Mr. Thompson should be educated on the importance of regular bowel movements, a balanced diet with adequate fiber and hydration to prevent recurrence. The nurse should also monitor for signs of complications such as perforation or sepsis. How should a nurse educate a patient who is prescribed a new antihypertensive medication while also taking a daily multivitamin supplement containing potassium? What potential interactions should be discussed and what measures can be taken to prevent complications? Answer: the nurse should inform the patient about the potential for hypokalemia, especially if the antihypertensive is a potassium-sparing diuretic such as spironolactone. The multivitamin containing potassium can increase serum potassium levels, which may lead to dangerous arrhythmias or muscle weakness. The nurse should recommend monitoring potassium levels through regular blood tests to assess for hypokalemia, reviewing the medication regimen to ensure that the patient is not exceeding the recommended potassium intake either through supplements or diet. Alternative medications may be considered if there is a significant risk of potassium elevation. Patient education. The patient should be educated to avoid potassium-rich foods, such as bananas or oranges, and to report any signs of muscle cramps, weakness, or palpitations. Key guidelines was FDA Drug Interaction Guidelines. The FDA recommends careful monitoring of electrolytes when combining potassium-sparing medications with potassium supplements. Patient safety standards. Nurses must assess the potential risks of drug interactions and educate patients to ensure safe medication practices. When teaching a patient with a recent surgical wound about proper wound care, what key steps should the nurse emphasize to reduce the risk of infection and promote healing? Answer: the nurse should emphasize the following key steps in wound care. Hand hygiene before and after touching the wound to prevent the introduction of bacteria. Proper dressing changes using sterile technique and appropriate dressings to maintain a moist wound environment which promotes healing. Monitoring for signs of infection such as redness, increased pain, warmth, or drainage, and contacting the healthcare provider if these signs occur. Avoiding excessive movement of the affected area to reduce the risk of dehiscence, wound reopening. Nutrition support to enhance healing, including adequate protein intake, vitamin C, and zinc. Key guidelines laws. Wound care best practices. The National Pressure Injury Advisory Panel (NPIA) provides guidelines for preventing infection and promoting optimal healing conditions. Infection prevention protocols. Nurses must adhere to infection control measures to reduce the risk of hospital-acquired infections. A patient with a suspected small bowel obstruction presents with abdominal distension, pain, and vomiting. What should the nurse anticipate in terms of diagnostic procedures and initial interventions? Answer: for a suspected small bowel obstruction, the nurse should anticipate diagnostic imaging. The healthcare provider may order abdominal X-rays or a CT scan to confirm the diagnosis and locate the obstruction. Initial management. The nurse should ensure the patient is kept NPO, nothing by mouth, to prevent further distension and vomiting. A nasogastric tube and G-tube may be inserted to decompress the stomach. Fluid resuscitation. Administer intravenous fluids to correct electrolyte imbalances and dehydration. Monitoring for complications. The nurse should monitor for signs of bowel ischemia, perforation, or sepsis, which may require surgical intervention. Key guidelines laws. National Institutes of Health (NIH) guidelines recommend early identification of bowel obstructions to prevent severe complications such as bowel perforation. Surgical consultation protocols. Immediate referral to a surgeon may be required if non-surgical management does not resolve the obstruction. MS Parker, a 35-year-old woman recently diagnosed with type 2 diabetes, is struggling to understand how to manage her diet and medications. She expresses confusion about the purpose of her medications and the timing of her meals. How should the nurse assess MS? Parker's understanding and develop an educational plan for her. Answer: the nurse should follow these steps. Assess understanding. Use the teach-back method to assess MS. Parker's current understanding of her condition, medications, and the impact of diet on her blood glucose levels. Develop a tailored education plan. Simplify the explanation of her medications, emphasizing the importance of timing in relation to meals and potential side effects. Use visual aids, such as a meal plan chart, to show her how to balance carbohydrates, proteins, and fats. Consider involving a dietitian or diabetes educator for a more comprehensive teaching session. Confirm comprehension. Ask MS Parker to repeat back what she has learned to ensure comprehension. Follow up. Set up follow-up appointments to reassess her knowledge and make adjustments to her care plan as needed. What are the most effective strategies for teaching a patient with newly diagnosed hypertension about lifestyle changes, including dietary adjustments and exercise? Answer: the nurse should educate the patient on the following strategies. Dietary modifications. Encourage a DASH dietary approaches to stop hypertension. Diet which emphasizes fruits, vegetables, whole grains, and low-fat dairy. Advise reducing sodium intake and limiting alcohol consumption. Physical activity. Recommend at least 150 minutes of moderate aerobic activity per week, such as walking or cycling. Weight management. Advise achieving and maintaining a healthy weight to reduce the workload on the heart and control blood pressure. Stress reduction. Teach relaxation techniques such as deep breathing, meditation, or yoga to reduce stress levels, which can elevate blood pressure. Key guidelines source: Hypertension Management Guidelines. The American College of Cardiology (AC) and American Heart Association are nursing education standards. Nurses are responsible for providing clear, evidence-based education to promote patient self-management of chronic conditions. A post-surgical patient is experiencing moderate to severe pain. What are the most effective methods for assessing pain in nonverbal or cognitively impaired patients, and how should the nurse manage the pain? Answer: for nonverbal or cognitively impaired patients, the nurse should use pain assessment tools like the FLA-CC scale, face legs activity, cry consolability, or the PAINA-D scale, pain assessment in advanced dementia. These tools allow the nurse to assess pain based on observable behaviors. Pain management should include pharmacologic interventions. Administer prescribed analgesics, considering both opioid and non-opioid options based on the patient's pain severity and history. Non-pharmacologic interventions. Implement techniques such as heat or cold application, positioning, and gentle massage. Ongoing monitoring. Continuously reassess pain levels and adjust the management plan accordingly. Key guidelines laws. Pain management standards. The American Pain Society emphasizes the importance of managing pain in patients of all cognitive levels, with specific tools designed for those unable to verbally express their discomfort. Nursing care protocols. Nurses should assess pain using appropriate tools and advocate for adequate pain relief, ensuring ethical and patient-centered care. What are the critical components of opioid medication education that a nurse must provide to a patient, particularly in light of the risk for misuse and overdose? Answer: the nurse should include the following key education points: correct usage, instruct the patient on how to take the medication exactly as prescribed, emphasizing the importance of not exceeding the prescribed dose or frequency, side effects and risks. Discuss common side effects, e.g. constipation, dizziness, and the risk of overdose, particularly in combination with other sedatives or alcohol. Storage and disposal. Advise the patient to store opioids securely and dispose of unused medication properly to prevent misuse. Signs of overdose. Teach the patient and family members to recognize the signs of opioid overdose, e.g. slow or irregular breathing, unresponsiveness, and when to seek emergency care. Key guidelines laws. CDC guidelines for opioid prescribing. The CDC outlines strategies for the safe use of opioids, including educating patients about risks, proper usage, and alternatives to opioids. Nursing standards. Nurses must provide comprehensive education on opioid safety and monitor patients for signs of misuse or side effects.